Hi, moms and dads. My name's Dr. Chuck Reinertsen, or as most of my patients call me, Dr. Chuck. So you got some kids, and you want to understand, when do you take them to the dentist? What should you do? What should you look for? Let's look at what our goals are, and then we can decide how we're going to get there, because these are special things. These are special kids. Their mind is like a sponge. It soaks up everything. So we want everything to be a good learning experience and a pleasant experience for them as they go through childhood and then into adolescence and teenagers and out the door, because it happens faster than you think. So one of the things that we want is a good experience. You can remember things that happened to you as a child. Your children will do the exact same thing. We want to make sure that their early experiences are good experiences. And with today's world, there's no reason it doesn't have to be a good experience. So if you can bring them in before there are any dental issues, let them ride in the chair, get their teeth tickled, see mom and dad have something done with them, it tends to really lessen any anxiety that they have. You're going to think I'm making this up, but true story. Yesterday I was in a store, and one of our patients whose kids had just been in like 2 days earlier than that said, "Hey, Dr. Chuck," and we're talking a little bit, and he always asks his kids on the way home from school or at the end of the day, what was the best part of your day? And can you believe going to the dentist was the best part of their day? I mean, it's a different world. It was not that way when I was a child. For many of you, it was very, very different. So it's nice that things have come that far to where it's not a big deal. It's really important, though, that they develop some of these habits early on of coming to the dentist on a regular basis. And as we've discussed in other videos, is that many times you can have issues going on in the mouth that don't hurt, but they're not healthy. They're not good for you. Children are the same thing. So sometimes if you wait for the first toothache before you bring them to the dentist, there's going to be some issues. Now, I have no problem referring children to the pedodontist. They're specialists. They work with children. They can use sedation. There's some other things, so that the first experiences are not bad experiences. We want them to be good, because, like I said, they're going to take them for the rest of their lives just like you take yours. Now, dentistry has changed, and they need to experience the new ways of doing things, so that, again, as they get older, it's not a fear. It's no big deal. One of the stories that we tell is we tell the kids about sugar bugs. Now, everybody has little bugs in their mouth. They're invisible little bugs. They're called sugar bugs. And they live on your teeth, and they go all around your teeth. And when you eat, especially when you eat sugar, they eat some of the sugar. They love this sugar. They eat this sugar. And when you're sleeping, these sugar bugs go poop all over their teeth. Oh, and this poop is so bad, it makes holes in the teeth. It makes the gums bleed. Oh. And if you wake up in the morning and you have kind of your mouth tastes funny, that's sugar bug poop. Oh, that's no good. You don't want that. So what we have to do is brush those sugar bugs off before you go to bed. Really get those sugar bugs off of your teeth. And if you get the sugar bugs off, then you don't have a mouthful of sugar bug poop. So just make sure they take care of their teeth. Now, when I've told that story in first graders, kindergartners, the teachers look at me like, "You're saying that? Well, would you rather I use the big words? Like we have some lactic acid byproducts that are going to demineralize the tooth and get..." No, come on. We're talking to kids. So it's sugar bug poop, eats holes in the teeth. It's not good. Brush it out. Make sure you don't taste it in there. Get it out of there, and it's going to be better for them. So anything that we can get them to get this stuff out, because in reality it is bad for us. We don't want it in our mouth. So it's just on their level a little bit more of that. So kids are special. We want them to grow up without a fear of dentists. We want them to grow up healthy, and we're on your side when it comes to them. So please don't wait for the toothache before you bring him into us. Bring him in before. And if we have to refer, again, we've got some excellent pedodontists in the area that we're happy to, and we'll work directly with. So whatever's best for your child, just like whatever's best for you. So that's how we want to help treat your dental situation and your overall health. So I'm Dr. Chuck Reinertsen. Hope you have a great day, and this is in the interest of your better dental health and your overall physical health. Thank you.